the issues relating to black people, that they're taken more seriously. At the moment, the data is there, people are shouting, but because it is being ignored quite a bit, people feel as if they're not being heard.
Having something like the Black Health Improvement Framework, embedding that into core practice would be pivotal, because many practices don't really know what to do and don't actually really understand what it means to be culturally sensitive.
There's so many important elements to this, but in terms of the framework, it's really important to have an infrastructure that we can work within for regardless of what the condition is.
So we fund and support work that is trying to understand the causes of health inequalities and then try to really raise awareness and drive policy action.
Now we know that in the UK, deep health inequalities continue to exist across our African and Caribbean communities. The existence of this APPG is actually in response to that reality.
Fibroids and reproductive health kept on coming up over and over and over again. So what we focused on for International Women's Day for 2024 and 25 is that we looked at womb health and we did, again with that, fibroids, endometriosis, PCOS, and all of those things kept on coming up, but overwhelmingly it was around fibroids.
There's an element, what Khan is doing in our role, and we take absolutely seriously, is providing some leadership. So we're not asking to help solve everything. We want to work collectively with our community.
So what we have to do is we have to, people who of influence have to try and understand, learn. So this woman said to me this meeting, she said, do you know, I just wish, she said, as a black woman, when I put my hand up in a meeting and a white person puts their hand up afterwards, they would always call the white person first. I can see people nodding. I have no idea.
Inclusive research and ethnicity data collection. Charles made a really good point. It's about data use, it's about data collection, and making sure that we are improving that when it comes to ethnicity, making sure that we have the granular data.
So if every period is a problem and it's disabling and it's very heavy and it's painful, this is a major issue. So the next time I go, I just fractured my wrist, next time I go to an orthopaedic surgeon, I want them as part of the routine consultation to say, oh Leslie, you're still having periods, which would be a tactful thing to say to a woman who's postmenopausal, and I am.
It's a comment more of a question, just to say it was really encouraging to see your framework, in particular the focus on training and education, and particularly with engaging some of the community.
How can we work to align the different frameworks that exist, not just for black communities, but also other marginalized communities?
So how do we get people to start talking about racism and feeling comfortable using the word? Because if we can't talk about it, then we can't tackle it.
Now, I just wanted to go back to what the councillor said about allies, and also flag that there's a difference between allies and comrades. Like allies can choose to stand with you on the front line, but comrades will fight with you on the front line. And we do need people to be more active and speak up and not choose to say things when they want to say things. Like, we do know the data is there, as you've been saying, you've been on board for 17 years in these sorts of forums, expressing these things about what's happening in our communities.
When I had patients recently, I could say, oh, this is what it can look like on your skin, rather than being confused at that moment. So I think it's really important that we're stressing the training that we're doing. And we actually got a paper about that, which I'm very happy to share. That was really championed by the students, so we can really get them involved as well, because quite a lot of them are very interested in really helping with that.
The Health Foundation, I've noticed, is part of this group and is funding it. They did a brilliant report called Against All Odds, and it's how to get change scaled. And I think, there's some of us in the room, we can act as early adopters for this. So we need, a range of people from the ecosystem.
So just to say thanks for everyone in the comments, we've noted that. And just like we did with the Fibroids work program, after the parliamentary session, we take all the feedback and then refresh it before it's then sort of published. Underneath the pillars is building trust and accountability. Trust has been the biggest barrier from our work over the last 8 years. And what we know is when you can get it right for one marginalized, underserved community, then you can triangulate that learning. And that is what we came to evidence over the next few years as we work with particular areas to test this out.